Okay, so what are the indications? Well, many years ago when the data was presented to the FDA to achieve a formal indication, transscleral cyclophotocoagulation got an indication for refractory glaucoma. How's that defined? Well, it's a little bit defined how you and your patient define it. So of course, failed filtering surgery is one definition. Another is just high pressure despite maximum tolerated medications. Every patient tolerates a different number of medications before they reach that threshold. And in fact, I have patients who won't tolerate any medications. Patients who cannot undergo incisional surgery due to scarring, and I can show you some examples of that. High pressure with minimal visual potential, where the morbidity associated with an incisional surgery would not be acceptable to a patient because there's little for them to gain. Keratoprosthesis, post-keratoplasty, uveitic glaucomas, I'll show you some examples of those. And transscleral cyclophotocoagulation has received special attention in the area of neovascular glaucoma because of its efficacy in this really profoundly refractory type of glaucoma. And of course, eyes with silicone oil, which are almost impossible to operate on with any ease. Patients who are unable to go standard surgery due to medical contraindications. And so these are patients who really, for whom a trip to the operating room poses risks. And transscleral cyclophotocoagulation can be done in the office setting, it can be done at the slit lamp. And if you think about the patient as a whole, what's our goal when we treat glaucoma? It's to preserve the quality of life for the patient. And the risk of bringing them to the operating room alone can really threaten their quality of life. And so if you can offer them something that doesn't involve the operating room, that's a real advantage. As I said, neovascular glaucoma has received a good bit of attention.